As we conclude this segment of the lecture, let's review the cartilages of the skeleton. So recall from Module 3 that we saw three types of cartilage as we were examining the connective tissues. We saw hyaline cartilage, elastic cartilage, and finally fibrocartilage. And recall that in general, the cartilages are typically found where both strength and flexibility are needed. So we know that bone is strong, but even living bone tissue is not as flexible as the cartilages are. So the cartilages provide a bone-like strength, but also great flexibility as well. The reason that the cartilages are so flexible is that the chondroitin sulfate, which is a material that's found in the extracellular matrix of cartilage, has the ability to trap a lot of water. And this allows the water in their extracellular matrix to be compressed. So for example, when we put weight-bearing forces on the cartilage, and then the cartilage will spring back to its original shape. We also see that the presence of the protein fibers in the extracellular matrix of cartilage also aids in both their toughness as well as their flexibility. The cartilages are avascular and also lack any nervous tissues, and because they are avascular, that is going to mean that they are relatively slow to grow, but they will also be very slow to heal if they were to become damaged. They are covered by a thin layer of connective tissue called the perichondrium. The perichondrium is a dense, irregular connective tissue which helps to reinforce the cartilage from its external surface. So we'll begin by reviewing hyaline cartilage, and recall that hyaline cartilage is the most abundant of the cartilages. It's found in a variety of places that are associated with the skeleton. It tends to be very good at resisting compression, just like bone is, but the presence of its very abundant collagen fibers also give it some additional flexibility, while at the same time also being able to resist a lot of stretching forces. It is principally located or primarily located at the ends of long bones, where it serves to protect the ends of the bones at the joints that are formed. It also helps to reduce the friction at the joint as the skeleton moves at that particular joint. It also connects the ribs to the sternum, composes the structures that form the walls of the larynx, the trachea, and also composes most of the structure that forms the external nose. And we see that it makes up the majority of the fetal skeleton, which is going to be later replaced by bone tissue. Next, we have elastic cartilage, and elastic cartilage has a little bit more limited distribution, at least compared to hyaline cartilage. It's typically seen in a few places where repeated bending occurs. So the presence of the elastic fibers in the extracellular matrix of elastic cartilage allow it to be stretched out or bent, and then return to its original shape. So we generally don't see that this is a weight-bearing cartilage. There are primarily two places that it's located, the external ear and the epiglottis. So as a refresher, recall that the epiglottis is a structure that's going to close off the trachea when we swallow, so that food is directed behind the trachea into the esophagus rather than being directed into the trachea. And finally, we have fibrocartilage. This is a highly compressible cartilage that has a really great tensile strength. So that means that fibrocartilage is kind of an intermediate between hyaline cartilage and elastic cartilage. So it can withstand a lot of the weight-bearing forces, just like hyaline cartilage. But in addition, it also has the ability to stretch to a greater degree than hyaline cartilage does. So pretty similar to elastic cartilage. It's primarily found in three locations: the intervertebral discs, the pubic symphysis, and in the knee joint as the medial and lateral meniscus. So remember that the pubic symphysis is a small pad of fibrocartilage that unites the anterior part or the anterior aspect of the two hip bones. And in females, this pubic symphysis allows for the pelvis to expand during childbirth. So it allows the birth canal and the pelvis itself to expand during childbirth. The intervertebral discs are found between most of the vertebrae in the vertebral column, and they allow the vertebral column a good degree of flexibility, but also being weight-bearing at the same time. And finally, the meniscus, the medial and lateral meniscus in the knee joints, are primarily composed of fibrocartilage, and these structures allow the femur bone to sit on top of the tibia bone and not slide forwards or backwards while the knee is engaged in movement.